Hey guys, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine. Today we're talking about lower back pain, and lower back pain is the classic problem that chiropractors treat. It's kind of the Joker to our Batman, right? But although most people know that chiropractors help with lower back pain, a lot of them don't know how or even necessarily why. Most people associate chiropractors with the adjustment, so they call that the popping or the cracking of the spine, and that's great. But there are some types of lower back pain that shouldn't be adjusted. In fact, they'll be worse after an adjustment. So if that's news to you, you're going to be interested in this. Stick around. Okay, so how can we tell whether a person with lower back pain is going to do well with having their lower back adjusted? Well, the first step is to do a really good exam when we meet the patient. So on their first day, we're going to put them through some paces to find out whether they're going to do well with it or not. Let's take 4 categories of problems that cause lower back pain, and I'll show you how that works. So the first category is a disc problem. The second category is going to be a postural issue that's causing the lower back to get irritated. The third is going to be a mobility problem. So the person has a very stiff, restricted lower back. And the other one is going to be an instability problem. So someone that has too much motion in their lower back. So on the patient's first day, we're going to do some tests to help find out what category that they're in. We're going to have, first of all, we're going to take a look at their posture, see what their posture looks like. Do they have a fallen arch? Do they have a low hip? Is something twisted or shifted? If there's no problems with that postural exam, we can kind of rule out that category and move on to the next category. Next, we were going to have the patient do some motions. So a lot of flexion and flexion orthopedic tests. And if flexion doesn't really hurt the person's back very much, then we can most of the time rule out a disc issue. So we're past that category. So what about extension? Maybe the patient didn't even know it, but when they arch their back backwards, they get a lot of lower back pain that they weren't even really aware of. We're going to have them do a few stability tests. So we're going to have them step down off a box to see if their hip can control them when they lower their heel to the ground. And we're going to have them lay on a table, and when we put pressure on their lower back and it causes some pain, we're going to see if when they tense their muscles, if that reduces the amount of lower back pain that they have. If those two tests are positive, that tells us that the person has actually some instability in their lower back. Their lower back is moving too much. And in this scenario, this person is not going to do very well with adjusting. They might leave that day feeling a little bit better. We stretch some things when we adjust it or pop their back. But the next day, or maybe even that night, they're going to say, man, my lower back actually feels a little bit worse. It seems like it's taking a step backwards. And that's not what we want. But let's look at the flip side of that coin. So if we take 2 steps back to that new patient's step down test and their instability test, and both of those tests are negative. The hip is in good control when they lower themselves to the ground, and when I press on their back, it still hurts just as much if their legs are raised. Those are signs that this person maybe has a mobility problem. So their lower back is locked up. They're not moving too much, they're moving not enough. And that patient would do great with some adjustment to their lower back, getting their lower back, the segments in their lower back moving better through a chiropractic adjustment. Those patients we like to see because that day they're going to get off the table and say, man, I feel a lot better. And then 2 days from then when we follow up with them, hey, lower back's doing a lot better. I can definitely tell it's heading in the right direction. But this scenario that we just walked through illustrates why it's so important to do a good exam on the patient and make sure that we know what type of lower back pain they're suffering from before we just adjust their lower back. Okay guys, so I hope you enjoyed today's video, and I hope that little algorithm that we walked through kind of made sense. So the good news about this video today is even that patient that we kind of talked about that wouldn't do well with an adjustment, there are things that we do in our office that help people with lower back pain like that, like rehab exercises and other therapy modalities, even adjusting other parts of the spine that are maybe locked up, other joints that need adjusting. But it really just goes to show that you really need to do a good exam and know what you're walking into before you just adjust somebody. So if you've tried some stretches, maybe you've even been adjusted before for lower back pain and it hasn't really done the trick, give us a call. We'd love to help you with that problem. Until next time, this has been Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better, faster.